Ever wondered how often seniors should really shower? It seems like a simple question, one with an obvious answer.
We're taught from childhood that showering daily is the hallmark of good hygiene, as routine as brushing your teeth or making your bed.
It becomes part of the rhythm of life. Wake up, wash up, get dressed, go. And for most of our adult lives, that rhythm feels right.
It helps us feel clean, energized, presentable.
But what if that answer isn't as straightforward as we've been led to believe?
What if, beneath the lather of soap and the rhythm of water cascading down our bodies, lies a truth that challenges everything we've assumed about hygiene, aging, and health?
Let's take a closer look. Let's peel back the curtain on one of the most common yet misunderstood aspects of senior health.
Because in a society driven by marketing campaigns, cultural conditioning, and long-held habits, showering has become almost sacred.
It's tied to identity, to dignity,
to our sense of being in control.
But what if that sense of necessity is more about habit than health?
What if, especially for older adults, the daily shower isn't just unnecessary but potentially harmful?
Across the globe, from New York to Tokyo, Berlin to Sao Paulo, the daily shower is seen as non-negotiable. It's considered polite, hygienic, and even virtuous.
But for seniors, this ritual might be outdated at best and dangerous at worst.
To understand why, we have to talk about skin. Skin is more than just what we see in the mirror.
It's the body's largest organ, our first line of defense against everything from bacteria and viruses to environmental damage and allergens.
But as we age, this barrier changes. It becomes thinner, less elastic, and far more fragile.
Sebaceous glands, which produce the oils that keep our skin hydrated and soft, slow down.
That means older adults are naturally more prone to dryness, flaking, and irritation even without washing.
When you introduce hot water and soap into the mix, especially strong soaps and daily scrubbing, you start stripping away what little oil remains.
For a senior, this can lead to xerosis, the medical term for chronically dry, itchy skin. It sounds benign, but it's anything but. Cracks can form, opening pathways for infection. Itching leads to scratching, and scratching leads to tears, and tears in aging skin can take weeks to heal, if they heal at all. This isn't just speculation. Clinical studies reinforce what geriatricians have been saying for years.
At the University of Pittsburgh, dermatologists studied the skin of seniors who bathed daily versus those who didn't.
The results were conclusive: those who showered less had healthier, more intact skin.
A similar study out of the University of California, San Francisco, found that seniors who used lukewarm water and washed only a few times a week had far lower rates of skin breakdown and infections. Even the New England Journal of Medicine reported that reducing shower frequency led to fewer skin tears in elderly adults, particularly those in assisted living environments.
And it's not just about dry skin. For older adults, the act of showering itself can pose real danger. Imagine trying to lift one leg to step into a slippery bathtub when your balance is already compromised. Imagine trying to bend down to wash your feet with arthritic knees or reaching overhead to shampoo when you've got limited shoulder mobility. According to the American Geriatrics Society, the bathroom is one of the most hazardous places in the home for seniors. Every year, thousands are hospitalized from falls that happen while showering or getting in and out of the tub. And for those who live alone, a single slip could mean hours, sometimes days, without help. The strain of showering can also trigger shortness of breath in those with heart or lung conditions. The warm, humid air can feel suffocating. Standing for long periods can cause fatigue or dizziness. What many of us take for granted as a simple self-care routine becomes, for some, a daunting physical ordeal. This is why the medical community is beginning to rethink hygiene not in terms of rigid routines, but as a dynamic, personalized practice. Rather than asking how often should seniors shower, the better question is, what helps them stay clean safely? For many older adults, showering once or twice a week is not just acceptable, it's ideal. And that doesn't mean sacrificing cleanliness. It means being strategic. Focusing on the parts of the body that need attention: underarms, groin, feet, and face. These areas can be freshened with a warm washcloth, a sponge bath, or pre-moistened wipes designed for adult skin. Adult wipes are a far cry from baby wipes. They're larger, often made with gentle ingredients, and formulated to soothe rather than irritate. Unscented options are best, as added fragrances can exacerbate skin issues. For those who still prefer a rinse, a handheld showerhead and a shower chair can turn a stressful experience into a safe and comfortable one. Grab bars, non-slip mats, and walk-in tubs are also worth considering. These upgrades aren't just about convenience, they're about preserving dignity and independence. But let's not stop with bathing. True hygiene is holistic. Hand hygiene is critical. Seniors are more vulnerable to infections like pneumonia and the flu. Regular hand washing, especially before eating, after using the restroom, or after being in public spaces, can dramatically reduce illness risk. Oral hygiene is equally vital. Poor dental health has been linked not just to tooth decay, but to heart disease, respiratory infections, and even cognitive decline. Regular brushing, flossing, and dental checkups can make a huge difference in overall well-being. Clothing matters too. Wearing clean clothes, changing undergarments daily, and regularly laundering linens can improve both comfort and. There's also a deeply emotional side to all of this. Personal grooming, like keeping nails trimmed, hair tidy, and skin moisturized, is about more than appearances. It reinforces identity. It fosters a sense of control in a life where many things may feel increasingly out of reach. For seniors dealing with memory loss, depression, or physical limitations, grooming can be grounding. A small act of care becomes a declaration: I matter. I am seen. Consider Margaret, a 78-year-old widow living in Florida. For years, she forced herself to shower every morning, despite worsening arthritis. The pain was so intense she began skipping breakfast just to conserve energy. After speaking with her doctor, she switched to sponge baths 4 days a week and showers only on Sundays. The change was profound, not just physically, but emotionally. I got my mornings back, she said. Now I have the strength to sit on the porch and watch the birds. Or Harold, an 83-year-old retired carpenter. After a fall in the shower left him hospitalized, his family installed a walk-in shower and shower chair. I was embarrassed at first, he admitted. But now I feel safer. I don't dread it anymore. These stories matter because they remind us that hygiene isn't one size fits all. It's personal. And it should evolve with our bodies, not fight against them. So, how often should seniors really shower? It depends. Not on tradition. Not on social pressure. But on individual needs. On what the body is asking for. On what keeps a person feeling clean, comfortable, and safe. Maybe that means showering twice a week and spot cleaning in between. Maybe it means modifying the environment to reduce fall risks. Maybe it means shifting our expectations and recognizing that cleanliness is a spectrum, not a checkbox. What matters most is supporting hygiene routines that work for each unique person. Routines that prioritize skin health, mobility, emotional well-being, and dignity. In a world obsessed with freshness and fragrance, the idea of showering less can seem counterintuitive, even taboo. But when we examine the science, the risks, and the real experiences of older adults, one thing becomes clear: hygiene should serve the individual, not the other way around. So the next time someone says seniors need to shower every day, ask them, is that belief rooted in need or just in habit? Because sometimes, the healthiest habits are the ones that challenge the norm. Let's care smarter. Let's care with compassion. Let's care in a way that honors the changing needs of our aging population. Because at the end of the day, hygiene isn't about how often you shower, it's about how you live.